undone me and you bet I felt it. I tried to beat you, but you're so hot that I melted. I fell right through the crack.
Hi guys, this is Dr.
And I'm
Dub
trying
on
to
Love
get
Songs
back.
on the Coast. Thanks
Before
for
the
joining
cool
me
done
on
run out, I'll be
KDPT
giving it my bestest, and nothing's
94.2.
gonna stop me but
You guys did a great job with your evaluations yesterday and had some amazing questions. And this is not the love sign that I see here. In fact, it reminds me of a pelvic ring. And so that fits our topic for tonight. So one of the first questions you guys asked was, I was so sure it was SIJ. I did not do the Laslet cluster. Is that okay? Well, remember the Laslet cluster does help you to become more precise, to know that the source of the patient's problem is in the sacroiliac joint. So if the patient is too irritable, yes, it's okay not to do the Laslet cluster. If you are able to make a decision on how to treat the patient, find an impairment that you can treat and the patient can get better, then technically, yes, you can not do the Laslet cluster. But if the patient is not too irritable and you're trying to decide, should I focus my treatments on the sacroiliac joint, it would be wise for you to do the Laslet cluster to give yourself more precision and more clear decisions when trying to make a choice of where to treat. All right, and so the second question here was, I was so sure it was SIJ, but the patient was so irritable. Should I do the Laslet cluster? In the case of high irritability, your job is primarily to decide, how do I help this patient reduce their pain and find a position of comfort? Should I use compression, external compression, like an SI belt to help them? So getting more information, more precise information about, is it exactly the SIJ or not? The risk of making them worse using the Laslet cluster is fairly high. So in the case of high irritability, remember your top priority at the base of your rehab triangle is reduce pain, improve posture, and so I think that is where you should focus. Now, in the highly irritable patient, someone asked, should I be doing quadrant with overpressures and PAs? Well, it depends. If the patient is really too irritable for you to be doing quadrant and overpressures, you may try to tease out whether someone has a lumbar component to this problem by maybe grabbing the rib cage, asking them to do a sit to stand or to stand or even to walk and put some traction onto the rib cage, and that might actually, if it decreases their symptoms, all of a sudden you realize maybe that there's a lumbar contribution. So not always do you have to do provocation testing for clearing. Sometimes you can just do things that you think will help the patient feel better, like many of the movement corrective tests, to see if the patient's pain goes down. If they fit the clinical prediction rule for manipulation for acute low back pain, and remember that the clinical prediction rule, pain less than 16 days, no pain below the knee, hip internal rotation greater than 35 degrees of at least one hip, FABQW of less than 19, and at least one level of joint stiffness. If the patient fits that rule, whether it is pelvic pain or lumbar pain, the right thing to do is in fact the thrust. Unless you believe that the irritability is too high, the patient's fear is too high of you doing that particular technique, or if you're doing a rotational thrust to the lumbar spine, if you feel like excessive rotation is a primary problem of the patient, then you might not want to add that kind of force to the patient's body. But barring that, if someone fits the clinical prediction rule and has acute low back pain, your best and strongest evidence-based treatment is the SI regional thrust or the lumbar neutral gap or the lumbar side bending and rotation manipulation. Another good question was, should I use the muscle energy technique or the SI regional manipulation? Whenever you can, if you feel that the patient fits a mobility deficit of some sort, whether that's in the pelvic region or the lumbar region, and they fit at least 3 out of the 5 of the clinical prediction rule, you should always use the SI regional manipulation. The muscle energy techniques have much lower evidence for their benefit. It is not well is not clear to us who would benefit best from the METs. And so I think from that standpoint, we always want to use the best treatment that fits the patient's signs and symptoms, that manages their key impairment, that their irritability or their fear and anxiety will allow. Another great question: do I need to look at ASIS and PSIS symmetry on everyone with what I believe to be SIJ pain? Well, I will say that ASIS and PSIS symmetry and ligament palpation is not very strongly validated. The sacrum, the pelvis, they are all very asymmetrical structures. There's a lot of abnormalities, so it's hard to make a good decision based on those findings. Now, if a patient is so irritable that you can't get them to move very well, you can't do many of your special tests, but you still need some direction on how to treat them, then looking at ASIS, PSIS symmetry it's okay. It's a lower level of evidence, but there's some case studies that support the use of it. Does every person with low back pain and SIJ pain have to have that ASIS, PSIS symmetry findings before you treat it? Absolutely not. Remember, when you look at the clinical prediction rule, there's no such findings. None of the predictors had anything to do with really any special test, anything related to innominate and sacral symmetry. So in reality, those findings probably have very poor validity. They should not be the primary driver of your decision. Many very high-level clinicians don't even look at ASIS, PSIS symmetry anymore. If the patient fits the clinical prediction rule, they use the manipulation. And for our last question for the night, what is the home exercise program after we do the SI regional manipulation? So let's say you do the Shibuka Slam and the patient feels 50% better. What is a home exercise program that would mimic the Shibuka Slam or your manipulation? Well, remember, your patient probably came in with some type of mobility deficit. So if they have an anteriorly rotated innominate, a posteriorly rotated innominate, you can use any of the METs or any of the mobilizations to help improve that mobility. If the patient was having a hard time bending forward or bending back, you give them some home exercise program that improves their mobility of whatever motion they're limited in, unless you think it's a motion that will continue to provoke and maintain their pain. Many times as the mobility deficits clear up, the patients then begin to transition into a movement coordination impairment. So your home exercise program eventually will become training people how to move better. All right, and as we close the evening, I just want you to know that all of these questions are fantastic questions. Part of what you're doing as you're practicing your evaluation skills is trying to wrap your head around what to do, how to make decisions. So if you will put your hand on the middle of the screen, right in front of you, you know who you are. Put your hand right in the middle of the screen. I'm giving you an internet high five, peoples. Good job. Well done. And as a word of encouragement, remember that I know many of you have just received your midterm scores. It is completely normal for it to be a tough exam because you are learning partly how to take a 100-question exam and how to take it quickly. And you're learning how we write questions. And this is all new material. So don't be discouraged, because in order to become an expert, you have to have made mistakes. I'm giving you opportunities to make mistakes, and it's okay. So you will continue to improve. You have to continue to believe in the system, believe in yourself and how hard you're working, and know that I am very pleased and very proud of how you guys are coming along. Okay, so just once again, for those of you who need it, put your hand in the middle of the screen. Internet high five for you. All right, have a good evening. This is Dr. Dub signing off with Love Songs on the Coast.
No more. It's your God singing right to be loved. I'm sure no need to open up your mind and see like me. Open up your plans and damn you're free. Well, look into your heart and you'll find love, I'm yours. Listen to the music of the moment, come and dance with me. I like happy family. It's our God-forsaken right to be loved, I'm yours. Listen to the music of the moment, come and dance with me.